All right, so on to chapter 15, preventative dentistry. And you can see that these are all going to kind of blend together. And when we talk about polishing in dental assisting, it also comes with patient education. And we have to do our best to try to prevent. And again, this is kind of the hygiene wheelhouse, but polishing is a hygiene duty. And in this state, assistants have that expanded function. So, you're not acting as a hygienist because they can do quite a bit more, but we still have a opportunity to help those folks that can't get in with the hygienist or are just doing polishing. Dentists who do some sort of preventative dentistry, although it's not a lot, they do a lot of restorative. It's not as much in their wheelhouse, but some dentists are more passionate about it than others. So hopefully you work in one of those offices. But really, you can go your whole life without having a cavity or ever getting a cavity ever again. Seriously, like it's that easy. I mean, there's going to be barriers in the way. There's going to be circumstances that put you at a higher risk. But if done right, we can totally prevent getting cavities. And here's a couple of graphics that again, I think photos and seeing is believing is really good. So that's why intraoral photos, when you are doing patient education or even on the computer, are really great. But there's a normal tooth, there's a tooth with cavities, and there's a tooth with deeper cavities, right? Deep decay on the upper left-hand side. There's a lot of stain on the lower left-hand side and gum disease and tartar everywhere and cavities, right? You can see the gum line. And then the picture on the right, again, shows you sometimes it's much deeper than you can even see it. And that's why x-rays are so vital in diagnosing decay. But we need to make our patients uh, responsible for their own health care. We can only do so much in the office, right? We can prescribe, fluoride prescription toothpaste, or we can do a lot to try to help them. At home, they can have fluoride toothpastes and things like that. But if they're not brushing and flossing and doing the things or using the products that we tell them to, it's all about patient compliance, right? So that can be really hard for some patients. And you have to make a bond with them. It's about creating a relationship. And then once you've created that relationship, it gets a bit easier. They start to actually listen to you. So this is what again, a hygiene does so very well, but they're going to be listening carefully. They're going to be giving initial instruction, talking about plaque and its link to dental disease. They're going to find out what motivates the patient. Sometimes it's wanting to have white teeth, right? Well, I'll tell you, if there's a layer of plaque and decay on there, you're not going to have white teeth. Sometimes it's to be out of pain, right? So you got to find out what motivates a patient. For teenagers, sometimes it's smooching, right? So we talk about that. Select home health aid. So again, this is where uh, your product exercise was really good to do, because you're getting introduced to different things that the patient can get at home, and some are good and some are snake oil, not good. So and then keeping it simple, really really coming down to that patient's level. You don't want to give them too high a level of information or too low a level of information. Each patient deserves patient education tailored directly to them. Even before birth, right? So while the teeth are growing in gestation, what the mom consumes, folic acid, calcium, like all of that, the child's teeth, and you're going to learn this, I think, in oral anatomy, start developing at like 4 to 7 weeks, right? So it's all important. And then understanding when it's appropriate to introduce fluoride for a baby or a toddler, that if the even before teeth erupt, you need to be wiping the gums to remove that bacteria. And we'll go kind of in depth with this during our pediatric week. But again, as soon as a tooth erupts, it's at risk for getting dental decay. And a lot of, kids have a hard time getting fillings, right? A lot of them need nitrous or to go under some sort of anesthetic. Dental sealants are really important in preventing dental decay. I still have all my sealants. We'll go in depth on this, but this is one of the big preventatives for dental decay. You can see the deep grooves and fissures and plugging those up so that the bacteria can't get in there. Some patients can brush 100 times a day. If their fissures or pits are too deep, they can't get to that. And, that sticky retentive carbohydrates will stick in there and cause decay. So if we seal them up, it can be very helpful for prevention. And as we get older, like starting, when we're smaller to old age, our teeth go through very normal stages, right? So the color of the enamel, depending on the staining, how much, surface cracks there are, so this all needs to be taken into account. And what is the best toothbrushes and best things home care for each of those people, especially even their mouth, right? Like, do they have a narrow mouth, a smaller mouth? It's funny, I sometimes recommend using a kid's toothbrush for adults if they have a smaller mouth, right? So you got to sometimes think out of the box. There are a lot of conditions that we'll talk to that are age related too, so age does not equal gum disease, right? But those folks are on a higher risk of having stability issues with their hands. They're on multiple medications that cause xerostomia. Those folks, especially right now, the older folks didn't have preventatives like we do. So they didn't really have fluoride, systemic fluoride. They didn't have those preventative measures as good as we do now. So it is getting better, but you might see older folks that are at a very much higher risk for decay. They'll also have just different changes, right? So you can see the varicosities underneath the tongue, the attrition, right? There's been more time to have attrition if they're bruxer, the pigmentation of their tissues, right? So all of that can be age-related changes. And saliva, we've talked about this like every class, every lecture is so important. The reduction of saliva is so detrimental to oral health, and it increases the risk for cavities, right? Saliva is a wonderful natural buffer and has minerals. And if even some folks that have saliva, the content of their saliva is not where it needs to be. So fluoride. All right, let's dive deep into fluoride a little bit. We've been using fluoride to reduce risk of cavities since the 1950s in the United States. It's been used in other countries for hundreds of years. It slows the demineralization process and helps remineralization of the tooth. It's a mineral. It naturally occurs in food and water. And you can have it both systemic and topical, right? So systemic means it's traveling through your body. You've ingested it. Topical means it's painted on your teeth or stays not within your body. Ways to receive some of this fluoride is prescription strength, right? So in the dental office, we can apply varnish. We can prescribe toothpaste that have a higher amount, right? If they're at a high risk. Even fluoridated water, right, is very important, especially with those developing teeth. We have, a battle right now going on, and, this administration says that fluoride is no good. They've accused it of causing autism. All these things have all been proven false. We know that in safe amounts, it is the number one way to get the most prevention to the most amount of people. There's only been one paper, and it was out of China, that showed that fluoride, and it was and they used a mouse and literally a gallon of fluoride, and there was issues with that. So, you can have too much fluoride. It can cause upset stomach. intestinal issues, dental fluorosis if at too high, but it does not cause the neurotoxicities that they claimed it did. And then the person who wrote that one research paper walked it back, and folks are still using that as like the that, oh, look, it's toxic. It's a neurotoxin. So science has proved over and over and over again that in safe amounts, this is really, really the best way to strengthen teeth as they're growing. Systemic fluoride you can find in food and beverages, right? So it's anything you're ingesting. In my Wilbraham office, any kiddo under the age of 16, if they live, and there's only 2 cities in this area that have fluoride in the water source. It is Holyoke and Long Meadow. And those folks have lower risks of dental decay. All right. So, and think about the very different populations that are getting the benefit of that water source. And you have to drink the water, right? Like I drink tap water in my water bottle every day. I have Springfield tap water. It does not have fluoride in it. I wish it did. Again, and it won't help my teeth. It only helps the teeth that are growing, especially those vulnerable populations that it's a good resource to have available to them. Excess fluoride is excreted through the body, through the skin and kidneys, and topical fluoride is directed right to the teeth, right? So minimum systemic, you're not swallowing and ingesting it. It's not doing something on a molecular level. It's doing something right directly to the teeth. So toothpastes, varnishes, foams, anything that you're applying just straight to the tooth and not ingesting. And like I said, there is toxic levels, right? You can ingest too much and have GI issues. So here is, I really think that you should memorize this grid here, and it's the threshold and what'll happen. But so if somebody who's at a smaller body size, say a kiddo gets into a tube of toothpaste and they eat a little bit of the toothpaste, it depends on how much they eat. They eat quarter of a tube of toothpaste. You can give them some milk. It'll actually reverse the toxicity of that. If they eat the entire tube of toothpaste, that's when you're going to get an acute toxic dose, and you should be calling, the poison control center. And that's a whole tube of toothpaste. If your kid's getting through a whole tube of toothpaste, man, you've got some delicious toothpaste. But it is very hard to OD on toothpaste. For fluorosis, if the patient's getting fluoride in the water and topically and prescriptive, and there's just too much, they can get dental fluorosis, and we'll talk about that in staining and what that looks like in a little bit. So it doesn't do anything to your body, but it will, affect the teeth. And that's why when we prescribe fluoride as a medication, we are finding out what sources does that patient already get. That water fluoridation, again, so safe, and at least it's monitored instead of somebody trying to fluoridate their own water. From a public health standpoint, this is the best way to deliver fluoride to the lower socioeconomic populations. And it is showing less risk of dental decay. You can find them in bottled water. They tend to be more expensive, right? So again, not as accessible to the folks that are lower socioeconomic status. Some foods and beverages might have fluoride added to it, but the dentist, especially pediatrics, if you're in a community, every kid under 16 should be evaluated if they're getting enough fluoride, it naturally or not, and be given a prescription for fluoride. It is really important, and not just toothpaste and mouth rinses over the counter, because they don't have a whole lot of extra fluoride. It's not as much as you would think of. So having that supplement is really, really helpful. My kiddo was on the supplement. I would not give my kiddo something that would have harmed them, right? And it helped create strong, healthy teeth. Toothpaste, Mouth rinses, gels, varnish, professional applications, those are all ways you can get it. And we can't not think about nutrition, right? So those three things, right? You have to have the tooth, you have to have the bacteria, and you have to have the fermentable carbohydrates. But sugar is in a lot of things, and your mouth will change different sugars into carbohydrates. So understanding how and there are some protective values to some of the foods we eat. We don't think of pizza as very, helping you prevent decay, but it's got cheese in it, cheese and nuts. They have this healthy oil that coats the teeth and helps protect the teeth. But there are some low key foods that damage the tooth that we don't really think about, right? You think, oh, candy, right? We know candy is sticky and retentive and it'll cause decay. But dried fruits, sunflower seeds, coffees, especially with cream or sugar, alcohol, sweets and candy, breads, crackers, chips, French fries, citrus fruits, right? I'm drinking orange juice right now. Sugary drinks is the huge one, especially with the adolescents, with all the Celsiuses and energy drinks and coffees with crazy liquid sugar in it, or even Gatorade. And like I said before, some waters are at a higher pH and will contribute to that caries process. But you have to have the person, right? And all of this matters. So on the left-hand side, like these are all things to consider when looking at their risk for decay. Sugar substitutes can be very, very useful. So especially anything with xylitol. Xylitol is a naturally occurring sugar. The bacteria in the dental plaque cannot metabolize xylitol. Therefore, it helps reduce your risk of cavities. So I have folks that I'll tell them, chew sugar-free gum, chew 5 sticks a day, and it'll help you prevent cavities, right? So that can be very helpful. I tell them 5 because if you chew 7 sticks or more, you can have adverse gastrointestinal effects. So be very careful with that. And dogs have an allergy to xylitol. So you don't want to leave xylitol out for the dogs to ingest. So you can find them in sugars, you can add it to your foods, you can cook with it. But again, having too much xylitol will difficult losing weight, GI issues, all sorts of kind of things toxic to dogs. So again, I use it. It's very helpful, but you just have to be careful with it. Sometimes I'll do a dietary analysis where I'm literally having them log every single thing that they consume. And then I am assessing their caries risk or what they're nutritionally at risk for. Some people don't get enough protein. Even some people don't get enough lipids or fats, right? Which is also really important. And I'm using that Canberra risk sheet that we've talked about before. Toothbrushes, right? Not all toothbrushes are made the same. There's electric or manual. I find electric is very helpful for my patients and not like the quips. The quips are kind of, Temu versions of a Sonicare or Oral-B, but there is a lot of science into these. And even if it's not for the bells and whistles, some of them have timers. Some of them will light up or give you an indicator if you're pushing too hard. So I really like electric toothbrushes, not only because they help remove the plaque and the biofilm, but because of all those additional things that could come along with them. And there's nothing wrong with a manual toothbrush. If someone's brushing their teeth really well using a manual toothbrush, I see nothing wrong with doing it, but a lot of people don't brush their teeth properly. Baby toothbrushes, right? So there's a little banana. Anytime I find out somebody's pregnant, when I go to the baby shower, I always bring them different stages of toothbrushes. I love the banana one. It's my favorite. So cute. Washcloths can be used, right, to wash the gum tissue, the bacteria off the gum tissue. There's so many different toothbrushes out there, and they all claim to have different benefits to them. But honestly, as long as it fits to the teeth and you like using it, go for it. And you're using it properly. And if your toothbrush is missing spots or you're missing spots, try a different shaped toothbrush. I really do. And you don't have to buy anything super fancy. You can find good Philips or Sonicare or Oral-B toothbrushes that are electric that don't cost $200.
And there are different ways, different techniques to brush your teeth. I really prefer the Bass method, right? So it's making sure you're getting that gum line and coming down off the gum line and then doing circles on the crowns of the teeth. But you really need to make sure that, I mean, patients all typically miss the gum line, and that's why they get decay right on that gum line. They're not angling the toothbrush into the gum line properly. I can't stress this enough. This 45-degree angle is really, really important. And a lot of patients will scrub brush. Like they think the harder they brush, the better. It's not true. It just needs to brush for 2 minutes, right? And you should only be using an extra soft or soft toothbrush. Medium or hard will rub away the gingival margin and cause more issues. Um, Sometimes you'll hear the doctor tell them not to brush that area of their teeth. This does happen. Gasp, gasp, I know. But sometimes if there's a traumatic lesion, it might inflame it more. So we'll have them avoid the area after periodontal surgery, after some extractions, or sometimes restorations. We'll have them really leaning on antibacterial mouthwash like chlorhexidine and brushing in the other areas to not make that even worse. I love an interdental aid. I mean, I'll have some patients come in, and if you have tight contacts, great. Floss is good for you. I'll have some patients, and I'm like, don't floss. Floss is not for you. You need something bigger than floss. So, Pixters is my favorite. I can show you guys. But anything that'll fit in between those embrasure spaces is going to be more helpful than floss alone. Uh, I find you can find these at the dollar store, or offices will help give away, and then you can buy them online. Wood wedges are also helpful. But again, flossing or interdental removal of plaque isn't just to get stuck food out, right? It is to manually move the plaque off the sides of the teeth. So getting something in between the teeth that's appropriate for the size of that embrasure space is really important. And yeah, some patients use floss before. I floss after. Um, you know, if you floss before, it helps anything that's stuck in there, the fluoride of the toothpaste, because then can access it. I think as long as you're flossing, I don't care when you're flossing. I do most of my flossing in the car, to be honest with you. I keep little floss picks in the car, and I do a lot of flossing in the car. And there are different aids. So we've got those little picks, the little Christmas tree, a rubber tip stimulator, super floss, which is thick tufted floss, picks especially for ortho. I mean, I've seen it all. Yarn can be used, right? So it's as long as you're keeping it pretty aseptic and not out where the cat is playing with it or whatever. But there are a lot of ways you can clean teeth. I highly suggest there's a video here from Waterpick, and it shows the corn and the dirt in between the corn and how a regular toothbrush cannot get into those nooks and crannies. I love a water flosser. I do. I love Waterpick and water flossers, especially. I mean, if you have super tight, healthy teeth, it won't do too much for you. But the irrigation of that water, and you can put a little bit of the mouth rinse in the tube. I like the handheld one, the portable water flosser. If you have crowns, bridges, braces, implants, I mean, anything, a food trap, an area that is thick where you always get food stuck. These oral irrigators are so helpful. You can floss with regular floss and then use this, and so much stuff pours out of here. So I really recommend that. With dentures, so we'll talk about this in another class, but when the patient comes in with dentures, we clean the dentures. So we'll put them in a plastic bag with a product called tartar and stain remover. It tastes awful, so make sure you rinse it off or clean it off after. And we put it in a separate ultrasonic. It does not go in the ultrasonic with the instruments. It does not go in the ultrasonic with the instruments, right? Because even if it's in a plastic bag, that liquid can permeate the bag and gross, right? Then you're asking your patient to put that back in their mouth. Some people will use beakers, like these jars, to go into an ultrasonic, but it does not go right in with the instrument in the ultrasonic. There's usually a smaller ultrasonic, and I can show you guys maybe in Tech 2 how to use that. It shouldn't be brushed with toothpaste. Soap and water is just good. Polydent has one, and they have to stay moist. They cannot dry out. It'll crack the acrylic of the dentures. And again, we'll talk about more of this in another class. Toothpastes. I love a toothpaste that tastes good. Um, some of them will claim to be whitening, but all it does, toothpaste, when they're whitening toothpaste, will have either some sort of hydrogen peroxide in it or be a coarser paste to help remove the outside of the tooth stain. The only thing that's going to change the inside of the tooth stain is bleaching the tooth, right? Whitening the tooth. Toothpaste cannot do that. You will get whiter teeth if you're brushing your teeth good, and it's a little taking that plaque off, and then it appears more white. Mouth rinses. So not all mouth rinses are the same. I like using Listerine without alcohol. If my patient has gingivitis, then I will recommend Listerine with alcohol for twice a day for 30 seconds each time for 2 weeks. And then after 2 weeks, I tell them to get a non-alcohol mouth rinse, something with fluoride in it. If my patient has dry mouth or is sensitive gums, I'll tell them to get Closes. All of these you can find in the pharmacy. If they have sores or ulcers, I like Paradex. So there is a lot of brands. Scope I like is just fine too, but again, you have to make sure the ingredients in it are what the patient actually needs, because not every mouth rinse is the same. We look to ADA. Now, ADA is a group of dentists that get together. It's like a club, right? So in this club, but they've got a high number. And they write the guidelines for home care products. So, in popular culture, if it has the ADA seal of approval, then it's a good product. Honestly, I think ADHA seal of approval would be better, because hygienists are into prevention, but these folks are doing the research first and they've got a lot of money. Right. So that is it for that lecture. And I believe this is 1 out of 3.